Healthcare is ever changing, and it's probably not dramatic to say that at this time it's changing more than ever. A lot of it's related to healthcare reform, which everyone knows about, but in the industry there's a lot going on in terms of trying to improve the efficiency. I think it's one of the few industries that hasn't improved with technology, and there's a real focus on getting the most value out of the spend that's occurring today. It's important to consider healthcare costs not just as costs, but also as investments. And the reason is that there is a lot of return that's being generated. And in order to understand and allocate those precious dollars that individuals or companies have, you're going to want to understand where the best use of that money is. Let me give you an example of what kind of return on investment you might see in the healthcare industry. For example, on average, only about 60 or 70% of individuals with a chronic condition are following the recommended guidelines for care. So these are individuals with heart disease, for example, or with diabetes. If we could get those individuals taking the right medications, making the right lifestyle changes, you could see returns on investment that far exceed 2 to 1 based on the published studies that are out there. There's many benefits to having a healthy workforce. I think that's obvious in some levels, just in terms of you need individuals who are productive and who are focused on their health as opposed to needing services for treatments and other conditions. So it's that strong correlation between health and productivity. We think that's very important for employers to think through and really make that connection when they're evaluating the costs and the benefits of the investments that they're making. When looking at healthcare strategies and healthcare investments, it's very important to look at not only what we think might happen in the future, but really use historical data as the basis of our projections. Historical data can vary tremendously from one population to another. The characteristics vary in terms of the prevalence of chronic conditions, for example, and average age can vary. So depending on the particular claim history, that will really drive what the most optimal solutions are going forward. I think actuaries can play a critical role in helping companies make key decisions around healthcare investments. The importance of looking at data and making sure that the decisions are based on data, and using that information in conjunction with looking at the economical impact as well as other areas, I think an actuary can play a key role in that.